Good afternoon to everyone. We are going to begin the work group meeting at 3:30 p.m. and Jeanette is here. She is giving us a presentation today on the emergency preparedness and response updates. And Jeanette, I know that you are on. I will turn it over to you.
Thank you so much. Good afternoon, everyone.
And Jeanette, I need to interrupt you. We do have Diego here. He is going to be our language justice representative. My apologies, Anjanette. Diego, I did see that you were on.
Yes. Hi, Sherry. Good afternoon, everyone.
Welcome.
Just real quick, you can hear my audio okay, right?
Yes.
Great. So hi, everyone. Diego Ponce here on behalf of the Community Language Cooperative. I'll be getting joined soon by my colleague, Maria Lisa from the CLC. Thanks as always for having us at your meeting. We're going to continue today making a commitment towards language justice. So all this means is that we're here to help create a space for people to participate and engage in the language of their heart, just simply the language that you feel most comfortable in. We'll continue using simultaneous interpretation in English and in Spanish to help create the space here in Zoom. So once I'm finished saying this in English, as always, I repeat it in Spanish. At that moment, we turn on the interpretation. When interpretation is on, you'll be able to see a globe icon that says interpretation there in the bottom right-hand corner of your computer screen. Please select that globe icon when it appears on your screen, and please select your preferred language. If you happen to be joining today's meeting on your tablet, I'll ask you to please look for the More button or the 3 dots button in order to select your preferred language that way. So if you're not fully bilingual, as always, we'll encourage you to please select your preferred language so you may utilize the interpretation whenever someone is speaking in the opposite language, or if someone were to speak in the opposite language. But if you are bilingual, you can just feel free to listen to everyone in their original language. You will not have to select any language channel, and you will not ever have to hear our voices. As always, when you select your language, you can check the original audio so that you don't have to be hearing both languages at the same time. As always, we like to remind the audience just to please pay attention to the speed in which you're speaking. Since Spanish tends to be about 20% longer than English, just please make sure that you're speaking at a conversational pace. No need to speak slowly for us, but please make sure that you also do not pick up your reading speed. So thank you so much for that. Buenas tardes a todos y a todas. Mi nombre es Diego Pons. Estoy aquí hoy de parte de la Cooperativa Comunitaria de la Justicia del Lenguaje con mi colega María Lisa. Como siempre, muchas gracias por invitarnos hoy a su reunión. Los organizadores de esta reunión se han comprometido hoy a servir la justicia del lenguaje, y lo que eso significa es que queremos crear un espacio para que todas las personas puedan participar e involucrarse en el idioma de su corazón, que es simplemente el idioma en el que todas las personas se sientan más cómodas. Y hoy vamos a utilizar la interpretación simultánea para poder crear este espacio aquí en Zoom en inglés y en español. Cuando yo termine de decir esto, vamos a activar la interpretación. Ya cuando la interpretación está activada, usted como siempre va a poder observar un icono de un globo terráqueo que dirá interpretación allá abajo en la derecha de su pantalla. Por favor, seleccione ese icono del globo terráqueo cuando aparezca en su pantalla, y por favor seleccione su idioma preferido. Pero si usted está asistiendo hoy a esa reunión en su celular o en su tableta, yo le voy a pedir que por favor busque la opción que dice More, que quiere decir más, o posiblemente el botón de 3 puntos para que usted pueda seleccionar su idioma preferido de esa manera. Y si usted no es completamente bilingüe, le vamos a pedir que por favor seleccione su idioma preferido para que usted pueda utilizar la interpretación cuando alguien vaya a hablar en el otro idioma. Pero si usted sí es bilingüe, se puede sentir libre hoy de escuchar a todos en su idioma original. No tendría que seleccionar ningún canal de idioma y jamás tendría que escuchar nuestras voces. Como siempre, cuando usted seleccione su idioma, puede hacer clic en silenciar el audio original para no escuchar ambos idiomas al mismo tiempo. Muchas gracias.
Thank you, Diego. And if everyone will find their little globe. Okay, and Jeanette, I promise I will not interrupt you now. Thank you for letting me introduce Diego. Please go ahead with your presentation.
Of course, no problem. Good afternoon, everyone. My name is Anjanette Hawkins, and I am the Emergency Preparedness and Response Coordinator for Jefferson County Public Health. Today, I will be updating you on our program's activities and our current promotional event. So today's updates will be our preparedness and response plans, project management platform that we're using, training and exercises, and our National Preparedness Month promotional event. So to begin, our preparedness and response plans begin with the Public Health Emergency Preparedness Plan, which we also call the FEOP. The purpose of the FIOP is to describe the basic strategies and mechanisms by which JCPH will prepare, prevent, protect against, quickly respond to, and recover from all hazard emergencies, particularly those that scale, timing, and unpredictability threatens to overwhelm our routine activities. We refer to those as incidents in one word. The processes described in the FIOP are the same for all public health hazards, including infectious disease outbreaks, environmental public health hazards, natural disasters, or any other threats to the public's health. The FIOP is organized into two parts. The first part is the concept of operations. This provides guidance based on three operation phases: prepare, prevent, protect, respond, recover, and plan annexes. So separating again, JCPH's FIOPs annexes are divided into two groups. Those groups are, one is the executive director's approval to activate. We call those response annexes. And those that do not require the executive director's approval, we call those ongoing annexes. Some of our ongoing annexes include community containment, epidemiological investigation, health alert network annex, internal and external communication, internal information and communications, the clinic annex, legal annexes, public information and communications, training and exercise annexes, and our volunteer annex. Our response annexes that do require executive director approval for activation are the continuity of operations annex, mass dispensing and distribution annex, and our medical surge annex. So in the next year, our program will be taking a very thorough review of our FIOP and accompanying annexes to help prepare for future incidents. As we review each plan, beginning with the FIOP, we will be looking specifically at our COVID areas of improvement that were documented. These documentation were done internally, countywide, regionally, statewide, and federally, and throughout COVID and after the response. We will also be reviewing CDC's public health emergency preparedness capabilities more in depth. We will be evaluating our plans to better align with an all hazards approach, and we'll be updating our plans to meet and excel the reaccreditation standards. So updating all of our plans takes a lot of coordination, organization, and team collaboration. Our partners at Jefferson County Office of Emergency Management introduced us to the project management platform Monday.com as the platform that they intend to use for emergency response. This platform was utilized by the emergency director for response efforts in Florida before he came to us in Jefferson County. So it's been tested and evaluated and used successfully in responses. We like that Monday.com is a customizable web and mobile work management platform. It helps us stay organized by tracking projects, workflows, visualizing our data, and provides team collaboration. It also includes automation capabilities and supports integrations with other working apps, which is very nice. We in EPR needed, did somebody have a question? No, okay. We in EPR needed a project management platform to help keep track, prioritize, and manage not only our response efforts, but also our day-to-day projects that we have to complete in the next fiscal year. So just to name a few of the projects that we're working on, reaccreditation documents, tasks, and due dates, our public health emergency preparedness required deliverables, reimagining our plans and keeping track of processes, community and partner meetings, notes, attendees, employee workloads, and upcoming trainings and exercises. We've spent the last few months learning Monday.com details, building out our boards, setting timetables, and assigning our tasks to each of the team members. and it's really helped us to create kind of a culture of information sharing for our team. Each team member can see what the other team members are working on, instant message them about the specific project, and keep relevant information within that project board. With Monday.com, we've really been able to stay focused, manage our projects effectively, and communicate quickly and efficiently. So we've also are participating in training and exercises. The first one, the JCPH Introduction to Public Health Preparedness for Volunteers, was an area of improvement item from COVID that we have actually already tackled. The Emergency Preparedness module is a self-paced course for Jefferson County Public Health volunteers to complete. The course complements that onboarding process for volunteers and covers relevant topics, provides them acronyms related to their volunteer experience. Includes sections of what it's like to be volunteered, or the volunteer activation, an introduction into the incident command system. We have detailed just-in-time training for specific roles and responsibilities. It also includes the health insurance portability and accountability, HIPAA, cultural competency, and all hazard preparedness. This course is available on CoTrain and has been audited for ADA compliance. We are also working on getting it transcreated into Spanish for those Spanish speaking public health volunteers. The training for incident command will cover the principles of ICS 100 and 700. And those principles, and we'll apply those principles to a familiar activity such as planning a party. So we have in JCPH EPR, we created a ICS hands-on activity called Snack Attack, where you plan a birthday party and you get to see the different roles of incident command. So that training is also on the introduction to public health volunteers. We also participate in quarterly radio drills to practice redundant communication when the internet or phone towers are inoperable. And although we are not hosting any upcoming exercises, we have been and will be participating in several before the end of the calendar year, including participating in planning work groups and participating as an exercise player. Some examples are cybersecurity exercise, water disruption, and a bioterrorism exercise series that will begin in early 2023. So September is National Preparedness Month, and a survey was submitted in the last 10 years showing that Americans have not really prepared because they have found that, or they think that emergency responders will help them. And over 60% expect to rely on emergency responders in the first 72 hours following a disaster. But the reality is that in a disaster, first responders may not be able to reach everyone right away. So therefore, we are promoting the Be Your Own Hero campaign and asking people to be prepared to take action in the event of a disaster. We are currently encouraging all JCPH staff and community members to create an emergency kit and emergency kit for shelter in place, as well as evacuation, like a go bag, so that our staff and our community members are ready when something happens. We have also promoted signing up for the Jefferson County Emergency Notification System through Lookout Alert. And we are also encouraging our community members and staff members to talk to their family members, including little ones, about kind of action plans that your family intends to take during a disaster, because because your family may not be together during a disaster. So giving that information to babysitters, anybody that might take care of your children so that they are aware of your family plan. And then also something that we haven't really done in this day and age is drilling, having drills with your family members, knowing where all the exits are in your home and practicing having to leave your home at night or during the day or in a hurry. So we are promoting community preparedness and being your own hero. So you can contact us on our 24/7 emergency support function 8 line, which is listed here. And then this is our planning team. We have 3 planners under me and our resource mobilization specialist. And thank you so much for letting us share about our program.
Thank you, Anjanette. Anjanette, I do have one question.
Sure.
Where are you promoting this campaign within the communities? I mean, how are you reaching people? I think that's just great that you're doing this, like your Be Your Own Hero campaign and all the other stuff that you're doing. How do people find out about this?
So we're promoting it in the weekly JCPH newsletter that goes out to staff. And then we also have social media posts that are prepared and are being sent out, I think, weekly.
One of the areas that I think would be very beneficial is to share it with the schools because they're all families. And so getting the information to the schools so that possibly they can get the information out, you would probably reach more people. I don't know how many people, go on social media, for instance, that would be able to find it.
Yeah.
So I think connecting with schools may be a great place to do that. Just an idea.
No, that's a great idea. Thank you for the suggestion. I appreciate it.
Harriet, you have a question.
Oh, just another it says I'm muted. Can you hear me?
Yeah, we can.
Okay. It gave me the little banner that says I'm muted. So my thoughts very related, Sherry, to yours. But there are other organizations that respond in terms of emergencies, and I'm thinking of the mental health center, but there's lots more. And are you using the same platform like the Be a Hero messaging and things like that other organizations are using? And if not, does it make sense to try to get this way of looking at things more widespread than just through JCPH?
Yeah, we are collaborating with the Office of Emergency Management for Jefferson County and their efforts for their campaign. I know several of our emergency preparedness partners are also campaigning through Twitter, Facebook, Nextdoor, on social media platforms. But I don't know if I have not seen anything specific from Jefferson Center or from the schools. So I will look into that and ensure that we are communicating with them on our efforts.
Christine Billings, I see your hand up.
My hand is up. Hopefully you can hear me. I'm
Yes,
in
we can.
Perfect. Just to add to that, Harriet, to your point about consistent communication, the Be Your Own Hero campaign, the language for that is actually a toolkit that is developed out of the federal government side. So you should see very similar language for all agencies who are promoting National Preparedness Month.
Other comments or questions for Anjanette? This keeps you all very, very busy. You've had a lot of responses to do and a lot of, you don't know what you don't know. And a lot of it came up during a lot of the incidents that you've had to go through. We really appreciate you all working on this.
You're very welcome. We enjoy it.
Okay. No other comments or questions? We will, I guess, adjourn this portion of the meeting. It's the work group meeting, and we will take about 10 minutes, it looks like, we will start the actual board meeting at 4:00 is what we have it on all of our calendars and our website and stuff. So take about a 10-minute break. It looks like everyone is back. Is my quorum back in, Lindsay?
Yes, it is.
Thank you. Okay, we're going to call the business meeting to order. It is 4:00 p.m. And Lindsay, can I get you please to do a roll call?
Sure. Hilda Gerke,
Present.
Harriet Hall,
Here,
Blaine Drager,
Present.
Sherry John,
Here.
and for the record, Kimberly Kropik is absent and a quorum has been established. Thank you.
Thank you. And we again are going to introduce Diego. I believe, Diego, you're the representative that's going to present the language justice for us, please.
The interpretation function is on and Diego is not able to talk to everyone when the interpretation is on. So we need to turn off the interpretation and then turn
Oh.
it back on after his statement.
Lindsay, is that something you can do
Yeah, hold on one
so that he can get back in?
Mhm.
It always helps when our representative can get in there to talk.
Yeah, thank you, Hilda and Sherry. He should be in, or Diego, you should be good to go.
Okay, can everyone hear me?
Yes, we can. Thank you, Diego. And thank you, Hilda, for making us aware.
Yeah. So hi, everyone. Once again, Diego Ponce here. We have the community on behalf of the Community Language Cooperative. Thanks for having us at your meeting. We're going to continue, making a commitment towards language justice. So that means helping create a space for people to participate and engage in the language of their heart, just simply that language that you each feel most comfortable in. Continuing the use of simultaneous interpretation in English and Spanish here on Zoom to help create the space. Once I'm finished saying this in English, I'll repeat it in Spanish. At that moment, as always, we turn on the interpretation. Once interpretation is on, you'll be able to see that globe icon that says interpretation there in the bottom right-hand corner of your computer screen. So please select that globe icon when it appears on your screen, and please select your preferred language. If you happen to be joining today's meeting on your cell phone or your tablet, I'll ask you to please look for the More button or the 3 dots button in order to select your preferred language that way. So if you're not fully bilingual, I'll encourage you to please select your preferred language so you may utilize the interpretation if someone were to speak in the opposite language. If you are bilingual, however, you can just feel free to listen to everyone in their original language. You will not have to select the language channel. You will not ever have to hear my voice. As always, when you select your language, you can check the original audio so you don't have to be hearing both languages at the same time. As always, we ask that you please pay attention to the speed in which you're speaking. Since Spanish tends to be about 20% longer than English, just please make sure that you're speaking at a conversational pace, and please make sure that you don't pick up your reading speed. So thank you so much for that. Hola a todos y a todas. Otra vez, mi nombre es Diego Pons. Estoy aquí de parte de la Cooperativa Comunitaria de la Justicia del Lenguaje. Muchas gracias otra vez por invitarnos a su reunión. Hoy nos vamos a continuar comprometiéndonos a servir la justicia del lenguaje. Y lo que eso significa es que queremos crear un espacio para que todas las personas puedan participar e involucrarse en el idioma de su corazón, que es simplemente el idioma en el que todas las personas se sientan más cómodas. Vamos a continuar hoy utilizando la interpretación simultánea aquí en Zoom para poder crear ese espacio en inglés y en español. Cuando yo termine de decir esto, se va a activar la interpretación. Ya cuando la interpretación está activada, usted va a poder ver un icono de un globo terráqueo que dirá interpretación ahí abajo en la derecha de su pantalla. Por favor, seleccione ese icono del globo terráqueo y por favor, seleccione su idioma preferido. Pero si usted está asistiendo hoy a esa reunión en su celular o en su tableta, yo le voy a pedir que por favor busque la opción que dice More, que quiere decir más, o posiblemente el botón de 3 puntos para que usted pueda seleccionar su idioma preferido de esa manera. Si usted no es completamente bilingüe, yo le voy a aconsejar a que usted seleccione su idioma preferido para que pueda utilizar la interpretación cuando alguien esté hablando en el otro idioma. Pero si usted sí es bilingüe, se puede sentir libre hoy de escuchar a todos en su idioma original. No tendría que seleccionar ningún canal de idioma y jamás tendría que escuchar mi voz. Y como siempre, cuando usted seleccione su idioma, puede hacer clic en silenciar el audio original para no escuchar ambos idiomas al mismo tiempo. Muchas gracias.
Thank you, Diego. And now if everyone will locate their little world globe and choose their language of choice. We will go ahead and begin. The first thing that we have, of course, on our agenda is the consent agenda, where you will see we have acceptance of agenda, the approval of the Board of Health meeting minutes. And I will just tell you that we all got so excited to hold on to a piece of our summer a little bit longer. We inadvertently wrote July Board of Health meeting minutes, and we meant to write August. So please know that there's a change. We're approving August Board of Health meeting minutes. And then we have approval of the warrants and approval of contracts, which will include the EFL Associates contract for executive recruiting services.
I move to approve the consent agenda.
Second,
Thank you. So we have a motion and we have a second. May we have a vote, please?
Yes.
aye.
Aye.
I.
Aye. It passes unanimously. Okay, we will move on. And we do have a couple of people, we're in public comments. We have a couple of people signed up in person today. We want to welcome them. And we have Dave Kaler, and please let me know if I have mispronounced your last name. And we have Lori Odom. We'll just go in the order of how they signed up. So Dave, will you go ahead and go first? And we have allotted 3 minutes for each person to speak. Dave, are you on?
I am, thank you. I don't know if I can start my video or not. I don't know if that's necessary.
We can hear you
So-
just fine. And it's Dave
That's perfect.
Kohler.
Kohler, yes,
Yeah,
good to see.
I had it
it's good to
spelled
see
wrong,
some
so
familiar
my
faces.
apologies.
No worries, no worries. I will go without video. It says I'm not able to open, so I will just start my comments if that's all
Okay.
right with you all.
Sure.
I appreciate that. So thank you for the opportunity to provide some comments today related to the discussion to move the Communities That Care grants to a new fiscal sponsor from Jefferson County Public Health. I'm one of the co-chairs of the Community That Cares Coalition, and Sam Taylor, my other co-chair, is also on. I see her on one of the many screens here, and a number of other members as well. I wanted to start by thanking Jefferson County Public Health for many years of support for our coalition, and the initiatives that have been started through Communities That Care continue to support youth in our community. A few you're likely familiar with, such as 12 Talks to Have with Teens, and our robust youth internship program that ensures youth voice in decision-making, and some policy work that occurred with Jefferson County Public Schools to improve health education have served to strengthen our community. This and other projects have only been possible through the broad reach and passion of our community board's membership, collaboration of many agency partners, and the support of the health department. Although we've appreciated the fiscal stewardship and human resources support of the health department, our coalition has recognized some challenges over the years. The primary challenges that led us to today's agenda were the high indirect costs associated with hosting our grants at the department, the sometimes lengthy process to contract with providers, and a difficult hiring process for working with youth interns. Based on this, and after conversations with health department leadership, our coalition board has voted to pursue a move to the Colorado Nonprofit Development Center. Our initial analysis was that this would be relatively simple. However, since the time of this vote, our coordinator has resigned her position, and we have been advised that there are some greater complexities with some of the associated grants moving to another fiscal sponsor. Regardless, today our board is still very interested in pursuing this move. We feel that there are several advantages that will allow us to utilize these funds more effectively, still continue to partner closely with the health department, and better meet our youth's needs. Our ask is that your decision today will allow this move with some flexibility. We'd like to ensure that the current staff are not negatively impacted by this transition. Our board has a meeting scheduled with the Colorado Nonprofit Development Center in the next week to review with them the decision that you all will make tonight, and to discuss our current leadership vacancy. We're not yet sure how this might impact their timeline and their acceptance process. My hope is that your vote will reflect that the Jeffco Communities That Care Coalition has the permission to move fiscal sponsorship from the health department, and that the direction of the health department would be to work with our chairs and our executive board to coordinate the transition in a way that best protects staff and sustains the various funding streams supporting this work. I greatly appreciate your time and willingness to consider this ask. as I see this as one of the agenda items for this evening. So thank you.
Thank you, David. Next, we have Lori Odom. Lori, are you with us?
I am with you, and unfortunately, I thought I wasn't going to be able to speak. So can you hear me all right? I'm very pleased to speak if it still works for you.
It absolutely does. We've certainly allotted the 3 minutes for each person that signed up, and you were signed up, so we'd love to hear from you.
Thank you very much. As a resident of Jefferson County for over 4 decades and a retired pediatric oncologist, I've had the privilege of participating in Jefferson County CTC since its inception. This evidence-based initiative has evolved into a vibrant coalition of organizational partners and individual community members whose work over the past 5 years has improved the lives of countless young people in Jeffco. I believe the strength and success of Jeffco CTC is because of its association with Jefferson County Public Health from the outset. Its leadership, ongoing valuable input of community partners and youth leaders, and expert consultants. Another fundamental strength of CTC is that we are organized and operate in alignment with the national model for substance prevention coalitions, allowing for members and board of our coalition to shape and lead the majority of the work that we've prioritized. The challenging issues facing our youth are increasing, and there is a growing need to decrease risk factors and enhance protective factors to prevent substance misuse, decrease hopelessness, anxiety, risky behaviors, and more. In my opinion, Jeffco CTC is poised to enter a new phase, one that necessitates increasing flexibility to meet the growing needs of our youth. We must bring more youth of diverse backgrounds and lived experiences on board, necessitating varied and flexible means of compensating youth for their participation, flexibility in hiring and onboarding, which are unfortunately structurally not possible at JCPH. We must also maximize the availability and use of the grant dollars to CTC. This is, as you know, very hard-earned grant money. I strongly support the vital importance of local public health agencies now more than ever. At this challenging time, however, for CTC to effectively accomplish its mission, I believe it's imperative to have a smooth transition to CNDC as the fiscal agent for the CTC and DFC grants that can be transferred, while supporting the current and valuable CTC staff who are funded by these grants. Thank you for allowing me to make these comments.
Thank you, Lori. We do have 2 people that sent in written comments, and I believe the board has received those. One is from Greg Duranlo and Stephen Marchetti, and we will be sure that those are put right with the minutes for this meeting so that they would be public. So we have those 2. Now we may move to the financial report. Salma, I believe you're going to give this financials.
Cherry, do you mind if I say something before we go to Salma? It will take me a few seconds.
Of course, Hilda.
I just want to recognize David and Lori and thank them for their participation and their comments. I personally value the public opinion, and I am really happy to see that people are signing up to express their comments. Thank you.
Okay, thank you. Salma?
Hello, everyone. I can share my screen. Okay, can you see my screen? And can you hear me okay? You can get it.
Salma, we're having a hard time hearing you.
What about now?
Let me hear you speak.
What about now?
It's very, very faint. Of course, it could be my ears. I'm aging.
No, I agree. It's a lot of echo and
Yeah,
the
it's,
screen is like halfway.
yeah,
Better now?
a little bit.
Can
No?
you keep?
It's
No.
kind of, it's echoing on your end.
Any better?
Yes.
Okay, perfect. So good afternoon, everyone. My name is Salma Jakan. I'm the county supervisor, and today I will be presenting the August 2022 financial statement. Can you see my screen? Okay,
Yes.
perfect. So as of this reporting period, and with 66% of the year complete, our total revenues are being reported at 56% of the annual budget, or 10% below budget. This is mainly due to our grant funding. As of August, we are anticipating that most likely we're not going to bring our entire grant revenues budget this year. This is because we are behind spending on some of our awards. However, that doesn't necessarily mean that we are losing those grant funds, since those awards are not expired until 2023 and 2024. The other thing that I want to highlight is the CTC and DFC awards. So there is a potential that we would lose on those, on bringing those grant revenues with the, if we determine, if the board or the sponsor determines to move these awards to a new fiscal agency. Charges for services are ahead of the prorated budget by 9%. I do want to highlight that this is mainly due to Vital Records team. This team continues to surprise us every year by bringing additional revenues. And as of August, they brought in 77% of the annual budget. So, and they continue to do that without increasing costs. So there's a lot of credit goes to that team for sure. In terms of expenditures, our total expenditures are being reported also at 56% of the annual budget, or 10% below the prorated budget. And this is mainly due to salaries and benefits. As you might be aware, we have a lot of vacant positions currently, such as the executive director position, in addition to some vacant positions that we are in the process of filling, as well as the hiring freeze that we have in place due to fiscal year 2023 anticipated budget challenges. Supplies and direct assistant line items, we continue to surpass these line items because of the minimal funds that were budgeted under these lines, and also because of grant reallocations to fit the program needs. Other services and charges or contractual services are ahead of the budget by 3%. Some supervisors are considering temp agencies or contracting with temp agencies to provide contractors employees in order to balance between the gap in the hiring freeze, and also continue to provide services to the community. Capital projects and equipments are at 55% of the annual budget. Intergovernmental, these are payment to states, are at 40% of the annual budget. We are anticipating that we would be getting some invoices, and we will be expensing this entire line item before the end of the year or by the end of the year. Interdepartmental or charges for services or cost allocation charges are ahead of the budget by 6%. As of today, the department utilized 55% of county transfer. So that's all I have on this. If you have any questions.
Are there questions for Salma on the budget? I don't see any.
Not for me.
Okay, we'll need a motion to approve the financials.
So moved.
A second, please.
I second.
And what is there, we'll take a vote. All those in favor, please just say aye.
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 Aye. Any opposed? Although there can't be because we were all ayes. That motion passes unanimously. We will now go to new business. And we are going to have a CTC presentation to the board by Jody Irwin.
Good afternoon, everybody. Just trying to get my camera and presentation going here. All right. Good evening, members of the board. Thank you so much for the time on the agenda this afternoon. Honestly, I'm very excited at the opportunity to present this afternoon. Yeah, I hope this marks a turning point in what has been a lot of conversation, a lot of discussion, a lot of fact finding over the past several months, and moving on to making some decisions and what the board has to do to move this process forward. So I'm going to present the facts as I understand them today. I'm kind of on both sides of the issue. And I'm happy to present my opinions as well. If you have questions or if you'd like me to provide those to you, I'm happy to do so. But I'm just going to kind of start with some background to lay out where we are. And this is all based on the briefing paper that you all received a few days ago. So just kind of summarizing that briefing paper. And there we go. So as you all know, the CTC board voted to move the project to a new fiscal sponsor. There's no argument that this could be done, that this can be done. I also have not spoken to anybody that doesn't want this to happen or doesn't think this should happen. I think where we got into, I guess, once we started to dig down into the details of moving this process forward, we found out that there were some challenges around how the grant funding could be managed. And so there's 3 grants that are associated with this project. And what we found out very quickly as we started to kind of look into this is we can't simply transfer grants. This isn't our funding streams. We can only terminate the grants. That's, I think, a very important point. One of the most important things that kind of came to the forefront early on is that we would have to terminate. So as we were starting to talk about this shift and potentially having staff resign their positions, realized that timing was incredibly important when it came to what we do with these grants. So lots of meetings with CDPHE and CDC, the fiscal sponsors for these grants. And what we have found out through that process is that the 2 sponsors are willing to possibly award 2 of the 3 grants to a new fiscal agent. Again, this isn't really within our control. There are some things we can do to make this a more simple process or a more effective process. But really, whether or not CDPHE and CDC decide to award those dollars at the end of the day, that's not up to us. And that's another point that I wanted to make is terminating all the 3 grants right now, or a month ago or 6 weeks ago, there would have been gaps in the project. There would have been gaps in employment for staff. And so we wanted to make sure that we really worked through this very thoughtfully with our sponsors. So with the 3 grants, the one that I constantly call the CTC grant, it's the Communities Organizing for Prevention grant. This is one that CDPHE has indicated they would be willing to award to a new fiscal agent. The other one from CDPHE, the Health Disparities Grant, they have told us they view this as a public health grant and that they would not award it to a new fiscal agent. And then the CDC Drug-Free Community Grant is one that it's up for renewal. So we're going through a process right now of reapplying for that grant. And they've indicated that they would be willing to potentially re-award that to a new fiscal agent as well. Like I've mentioned a few times, the timing of this is very important. We've heard for the last several months how valuable this work is, how valuable this project is. And if we were to just say, let's cut our ties with our sponsors, I think that would create problems with the project and with the staffing as well. So discussion that I just want to point out to the board that there are a lot of options before us. One would be just terminating all 3 grants. And this is something that could have been done immediately several months ago. We could have said, okay, let's just let go of these and let the new fiscal sponsor pick these up and take those. but again, wanted to make sure that there weren't gaps in the project. You could choose to have us reach out to CDPHE and CDC and say, we're going to retain all 3 of these grants. I'll talk a little bit more about kind of the potential shortfalls in that approach here in a minute. Should we retain the Health Disparities Grant, which would not be awarded to a new fiscal sponsor? Most likely that funding would go to another public health agency if we decided to terminate that. And then the other discussion points are just the timing of the CTC grant and the DFC grant to make sure that a new fiscal sponsor has a relationship with CDC and CDPHE, and that they're ready to execute a contract to take on this funding. And in which case we would terminate just to align with that them signing the new grants. I do want to talk about fiscal impacts. This is one of the big reasons that I'm here today and asking the board for feedback. The 3 grants together equal around $670,000. Because this is a major impact to our budget, it's something we just want to make you aware of. With the indirect funding has been a major point of conversation over the last several months. So this would result in, if we terminated all 3 grants today, this would result in up to $187,000 decrease in indirect funding that we receive from those grants. Again, just pointing that out, this would require us to find ways to cover those dollars or request to the county additional transfer from the general fund to cover those costs, because they are written into our 23 budget. As far as I know, they're already written into our 2023 budget, at least for the first half of the year. So that's worst case scenario, that $187,500. But it is a point I wanted to make kind of on both sides of the issue. Yes, it's a high indirect rate. It's a lot of funding. Our goal isn't to make money off these programs or these projects, but at the same time, the county has been telling us you need to reduce your reliance on the county transfer. You need to increase your reliance on grants. And there's a reason that the federal government and that the state health department negotiates an indirect rate with us, because there is administrative costs to these things. I believe that indirect rate buys you a lot of support, a lot of backing. But at the same time, as our community members mentioned and have said even last month, there are some administrative burdens. And there was a lot of folks who, the reason the CTC board moved or voted to move was because of those administrative burdens, the high indirect rate. And some folks felt like I should mention that today, but I felt like it was really, really important that's why they want to move. And there are some administrative burdens associated with a government organization, and that's a fact. And I couldn't go through this presentation without sharing that with you all. So there's 2 sides of that. It buys you a lot, but at the same time, there is some additional steps and sometimes a lot of additional steps in these processes that we have to take. So my recommendations to the board, and I put a check mark on the first one because Dave verified this just now in his comment, verify with the CTC board that they still wish to move the program. I want to verify capacity with our staff to make sure. I've had multiple people reach out to me and say that they are prepared to support and assist and keep this project going while we try to time those terminations to align with CNDC being able to pick this up and run with it. And I'm in full support of that. Retaining the Health Disparities Grant is one that I think, the CTC and the drug-free community grants, they really have a lot of alignment. So it makes a ton of sense that they should definitely go together. If the Health Disparities Grant could move, of course, it makes sense to align that one as well. But it wouldn't be, I think, completely out of line. We could do complementary work if the Health Disparities Grant was retained here in the health department. That would be my recommendation. I honestly want to reach out one more time to CDPHE and just verify for a 3rd or 4th time that they're not interested in moving that funding. And this one, the CDC DFC award gets a little tricky for me. We were starting the process of applying for this. And we went back and forth, me, the county attorney's office, about how to approach this one. And to me, I would have a really hard time if the CDC said, we're going to award you this grant, but a month from now, we're going to be ready to re-award it to a new fiscal agent. And so while we're going through all the steps of processing this award, accepting this award, we're also working with the county attorney's office to write a termination agreement. I think and what I've been told is more likely it's going to be several months before CNDC and DFC or CDC kind of come to terms on an agreement. So to me, continuing this award, for 3-4 months, I'm totally fine with that. But if it's going to be weeks, hopefully CDC would be willing to work with us and say, okay, we're okay with a little gap here. Let's just wait until they're ready to make that connection with CNDC. So those are my recommendations. I am going to share an opinion here. My opinion is that it would be great if all three of these grants could remain together and move to the new fiscal sponsor. Honestly, I think that's what makes the most sense, but I don't think that makes sense to CDPHE with that one grant. But again, I'm very willing to reach out to them and ask them one more time if they're willing to move that funding. So really for me, the issues have been making sure there's not gaps in the project, that there's not gaps in employment for staff, and that our staff have the capacity, if we're going to continue to do this work, process these grants, invoice these grants, that we have the capacity to do so for the next, month, 6 weeks, 8 weeks, 12 weeks, whatever it ends up being until that connection is made between the new fiscal sponsor and the current sponsor. So those are my recommendations. I also want to talk about something that was asking me a couple of months ago. Is this a Board of Health decision? And I know Jean Biondi from the county attorney's office is on here. We spent a lot of time talking about this. And one of the big reasons I wanted to bring this is because there are major budget implications. As we've talked about, as I presented to you, our organizational budget, the major cuts that we're facing for next year, wanted to make sure that this is also on your radar screen. It also has policy and strategy implications moving forward. Is it our role as a public health department to start coalitions to grow things like this and then have them move elsewhere? I honestly think it is. I think we're good at it. I think we could be better at it. I think moving forward, we need to be more intentional about it. We don't have to have that conversation today, but just something to kind of be on your radar screen with everything we're going through right now as an organization. I think over the next couple of years, we need to be very thoughtful about how we do these kinds of things. And if we take on something that we feel like is going to go this direction, we need to make sure that we're all on the same page. And I had some great conversations with staff about this today. Are we very intentional? Do we have a written policy about how we're going to approach these things to make sure that when these kinds of transitions happen, that we're ready to just flip a switch and make them go? And then the signature authority is interesting for me to sign termination agreements to the tune of potentially up to $670,000. I don't know exactly how that works and what that looks like. So at the end of the day, you all could decide when you go to your executive session and work with the county attorney's office about, is this a decision for us in the health department? Is this a decision for you? And I just would really appreciate the conversation and the feedback on that as well. So with that, I would love to try to answer any questions that you all have on the process, on the presentation. I'll try to go into the grants. I don't have details of the grants, but could speak generally to the grants as well.
Thank you, Jody. I think Sherry lost connection, so I'm going to go ahead and try and facilitate until she can return. Board, any questions for Jody?
Hi, Len. Sherry, I think she's back. I don't know if you want to say something, Sherry, before I.
No, please go ahead, Hilda.
Oh,
And
okay.
thank you,
Perfect.
Lane. It kicked me out again.
Yeah. Okay, good. First of all, I want to thank you, Jody, for this presentation and to give a broader perspective of the situation. I'm really grateful for this. I missed the last meeting, so this is important for me to catch up. And I'm wondering if the CTC board was aware, and I don't know if you can answer that question or not, but were they aware of these implications with the grants before they make the decision of find a different fiscal sponsor? Do you know?
I do not know.
Okay, well, maybe something that I would like to know somehow, if we can figure that out. And I am still kind of confused of what is the board going to decide on what? I mean, what is the decision that we need to make in here?
Yeah, let me put this back up. So I can go to. So really the decision that needs to be made is, are we willing as an organization to continue to manage these grants until the new fiscal sponsor is prepared to be awarded those grants? And at this point, there's two that are in that discussion, and potentially, again, the third one's pretty much off the table. We've had a lot of conversations. I've asked this a couple times, and the state has said we would prefer this to stay with a local public health agency. So that's the conversation, is if this project is going to go away, if the staff are going to move, are we willing to continue to manage as the fiscal sponsor between now and when that happens? So that's, I think, the big decision. Or is the preference to terminate all three of those grants and kind of leave it up to the CTC board, CNDC, and the two sponsors to work out agreements, and when that gets worked out, that gets worked out. CNDC can decide to rehire this existing staff, or they could potentially decide to hire new staff for these grants if they receive those. And then, do we want to, as a health department, if two of those grants are moving, should we retain the Out for Safe Spaces project under the Health Disparities Grant? Which is, again, it definitely aligns with the other two. It complements it very nicely, so we could keep it. To me, it still makes more sense if they were together, but it just doesn't look like that's going to be possible. So do we want to keep that one grant if the other two are going to move?
Thank you, Jerry. This is definitely no easy.
Hey, Jody,
My
can
last,
you,
Lane,
Oh,
go ahead.
go ahead, Helen.
just my last question. You mentioned something around the 670K grants. When those grants were originally submitted, were they supposed to support CTC only, or they were supporting other programs and CTC?
They're very focused, at least two of them. So the Communities Organizing for Prevention is very focused on the CTC project and in engaging a community board, engaging youth. So that one's very, very focused, very, very specific. And that's exactly what it's done, and it's been managed very well. The CDC grant also aligns very, very nicely with that. It requires a community coalition. And so it's those two work together incredibly well, but those were both very focused on the one sets up the CTC project, sets up the coalition, and the other one through the CDC just complements it, allows them to do more work kind of along the same the prevention work.
Okay, thank you, Jody.
Lane, did you have a comment?
Yeah, I was trying to understand which grants are funding current JCPH staff that work on this, and how much of the grants are already going to the coalition to spend.
So right now we have, I believe, 4 staff that are all funded in different ways under all 3 grants. So their time is kind of broken out so that they can work on all 3 of these in different ways. Right now, all the funding comes to us. I don't believe that the CTC itself as a board or a coalition receives any kind of funding or reimbursement. My understanding is they're a volunteer board that are just working as part of this project.
And I guess I meant, thinking of hiring students and things like that. So that's all just handled through you guys, but I mean,
Yep.
that money is going to that work, right?
Yep, it's all through JCPH and all go into the work, except for those indirect funding that is taken off the top of the grant.
And how about is it all connected to some of our opioid work and some of the new coalition work that's started for that? Is any of this funding connected to that?
This funding is not connected. There's alignment among the projects and the staff, but as far as it's not going to harm any of that other work if this is moved somewhere else.
Okay.
Harriet, I see your hand.
So in response to Hilda's question, you talked about the 2 grants that would be moving and kind of what they did. The grant that would then be staying with us, how does it coordinate with the work of the other 2 grants and the CTC work? How could it coordinate if it was coming to us, but still needed to align with them? And are there any advantages to that in terms of ensuring the collaboration between public health and the rest of the community, if in having it that way?
That's a great question. I don't think we have multiple projects that have been aligned with this work for a long time. And that's the goal today. And everybody I've talked to has said, yeah, we would continue to work with CTC. Doesn't matter where they are, doesn't matter who the fiscal sponsor is. We have multiple programs, projects, staff inside this organization that have been very engaged in this work. And that'll continue to be the case. Even if the health disparities grant stays here, those staff can continue to work very closely in alignment with the staff who would then be at CNDC. So I think advantages, disadvantages, honestly, that's honestly kind of a CTC board question, really. I think they have seen that there's advantages to moving and there's advantages to continuing to work together and align our efforts. I don't know if having the health disparities grant remaining here while the other ones leave is going to create conflicts or problems or issues. That's why I kind of wanted to raise that if they do see that there's some kind of conflict or issue with us retaining that grant, then I would want to have a conversation about whether we do so. But again, it's most likely that funding would be lost if we just terminated.
Are there other comments or questions?
I have another comment, Cherry.
Hilda?
Yes. Is there any possibility to hear, and I know that it might not happen today, the possibility to hear what is the CTC board position on what they would like to see happening? I feel like I would like to hear their position on this discussion points that you are sharing with us, Jody. Is there any way that we can hear their position on these discussion points before we make a decision?
Thank you for bringing that up. My answer is I hope so. I think that's a question for Carrie Merkel to kind of inform the board whether we would be able to bring Dave on to kind of give his feedback on this. And I hate to put him on the spot. So the other side of that is whether he is feeling prepared or ready and willing to make some comments.
Sherry?
Yes, Carrie, did you want to say something?
Yes, if what Jody was saying, is it possible for the board to hear from Mr. Kohler at this time? If the board would like to ask Mr. Kohler questions, I think that would be fine. If he is prepared, and if he is not prepared, as Jody said, I would not want to put him on the spot, but he's certainly there, and you would, if you have questions for him.
Well, I think it would be good for us to get these questions answered as much today as we can. And I know that listening to him at the beginning, that he was very supportive of being able to make the move and stuff. Mr. Kohler, are you still on?
I am, And if you can see Sam Taylor also, if you can unmute her, I know she's the other co-chair.
And unmute, I'm
more than
sorry, I
happy to.
didn't hear the name.
Oh, I'm sorry, Sam Taylor.
Oh, Sam. Lindsay, did you get that?
Yes, I was just able to unmute myself. I'm happy to respond to that since Dave shared, and I can respond to that, and Dave can certainly add, and we're happy to answer any questions. We'll, as always, do our very best to represent those decisions of the board and the communications that they have shared with us. As the board has discussed these grants, while, as Jody said, it would be lovely to be able to keep all of the grants together, even if we cannot, which seems most realistic with a short-term grant and a grant they would like to stay with the health department. I'm confident that folks who are moving forward with the health department grant, the one that would not be able to move as easily, I'm confident that we would collaborate still very closely, and our health department colleagues and close co-workers on these, we would collaborate with CTC, and it would still move forward as a community project, even if it was a project of JCPH. I'm confident we would all continue to really work well together. What the board is really hoping for, we have voted in the past to be able to move fiscal agents for the variety of reasons that we have shared, even if that means only moving the 2 grants that are able to move. The board is really looking for the Board of Health to give the autonomy to the board. It's a community-led board, and give that autonomy to the board to be able to make the decisions that the board thinks is in the best interest of this community project and the community. And so at this point, that would be what they're looking for, is for the Board of Health to approve that if CTC would like to transition, that we terminate those 2 grants, as JCPH terminate those 2 grants and allow them to move to CNDC, if that is what the board still wants to do and is able to meet those timelines. Give that permission and ownership and authority over those community decisions to the board. And so the things we've really discussed is, yes, the board supporting the decision-making to happen soon so that we can move these projects and move this project going forward, to support this project and this process to be as seamless as possible, to really support our staff, our community partners, our community projects, and our youth interns, support this through this transition. And then knowing that if only 2 grants move and 1 grant stays, we are a very strong community. We're a really strong community coalition, and we would continue to work closely together. Dave, would you like to add anything to what I've said?
No, I think you said it perfectly. I think the one thing maybe for context is, where you may be seeking some details we don't have, is this has been a little bit of a chicken and the egg. Working with Colorado Nonprofit Development Center, they needed some of the information regarding what grants may move. And working with you all, you need some information in terms of what does timelines look like with CNDC. And so really this has been sort of the pivot point for us, or at least the most integral decision, is what grants do we have permission to move with, so we can continue those conversations and figure out transition. At the same time, as Sam said, protecting staff, protecting the projects, and making sure we're set up really well for collaboration in the future.
And I'll be meeting with CNDC on Thursday to share any discussions that come from today's meeting, to kind of try to answer questions in both directions.
Lane, I see you have a question or a comment.
Yeah, thank you. And ultimately, my goal is to make sure our community still has the services and the work continues. So wherever that best fits is ultimately what I want to make sure happens. So my question, I guess, is to make sure you've done that due diligence vetting CNDC to make sure that their indirect is lower, that you're still getting all the services you need. So I think Jody highlighted, JCPH comes with legal support, it comes with IT support, it comes with obviously the fiscal agent doing all that work, and communication support in addition to the staff. So just making sure you have the robust package you need as you look to move, because I'm not familiar with them, so I don't know their track record and where they work, but making sure that you've done that. And then obviously the other piece is, as Jody has highlighted, is that the funding is going to move. So I want to make sure that it's not just we hope it will, that you have at least some assurances from the state, or in the case of the application that's about to be expire at the end of this month, that you feel really strongly for any application you would put in. So those are kind of the questions I have.
Thank you. Jody, do
And
you
I'm
have
not sure.
a response?
I'm not sure if Jody's best to answer
Yeah.
that or us. I know
No,
maybe for
David,
the
go ahead.
second part. Yeah, I was gonna say, I think for the second part of that, I think that's, where we're still at. I think that's why, when Sam was speaking earlier, what we're hoping for is the permission to make those moves if all those things line up. Lane, I think all the things you said are the things that we want to make sure, all the boxes we want to make sure are checked. We can't have that discussion until we have an answer to these are the funding streams that will go at the same time. So we feel very confident in the initial exploration that we were able to have with CNDC, but are at a stage where we need to get into those really technical details at this point.
Thank you.
I appreciate you all answering the questions, because I know that as the board had said before in the previous meeting, I think it was in July, when you all first came and said that you were going to take a vote to do that, that was all of our concern, is that we got to make sure all of this stuff is still going to be available to the community. It has been just an outstanding program, and everybody has been so supportive of it. So we just need to make sure that everything's done with all of our I's dotted and the T's crossed, so nothing gets dropped.
No, thank you for that.
Sherry, can I?
Hilda?
Yes, hi, thank you. I just want to make sure that what you guys expressed, Sam and David comment, it is what I understood is you prefer, or what you want as a board, as a CTC board, is to keep the two grants, the CDC and the COFP grants, to keep them with you, and you will, like Lane mentioned, make sure that you have all those transitions in place, so this program doesn't suffer from lack of funding. And that is what your board is looking to obtain. I just want to make sure that I'm clear with that request.
Sam? You're on mute.
I don't think she's able to
Oh,
mute.
Lindsay, can you unmute Sam? Sam Taylor.
I apologize. I didn't realize if I
There you
muted
go.
myself, I wouldn't be able to unmute. So I'll keep myself unmuted. Yes, that is, we're wanting to transfer any of the grants that can transfer. The reason why we're saying go ahead and transfer the two and the other remain with JCPH, because and we'll collaborate, is because the communication that we've received thus far is it stays with JCPH or it goes to another health department, but that it cannot transfer. If all can transfer, and it can transfer in a smooth and quick fashion in order to get this work done, because that third grant is a relatively short term. If all could transfer very quickly, then we would love the board to be able to approve to transfer all the grants that we are able to transfer. The reason why we say the third one to stay with JCPH, and we've discussed that, we've suggested that, and to collaborate, is because we've been informed that it cannot transfer, that it needs to stay with the health department.
Okay, thank you, Sam. And you guys are, I don't know if okay is the right word, but do you guys are understanding the best way to do this will be to terminate the grant, and then you will pick it up with a different fiscal sponsor. Is that correct?
That's our understanding. And I think maybe to Jody, maybe I'll pass this one to Jody. I think that's where the timing, I know that he had it on his slide a couple different ways. That's where this timing piece is really important. And that's where we need to have the conversation with CNDC to be able to work with JCPH around how best to do that to create this seamless move.
Jody?
Yeah, no, and I would also, I think as we talk about more exploration into this process, I think it does give us opportunity to look at that third grant as well, and just make absolutely sure. And also, if there's other grant funding opportunities out there that could also support this move. And if there's some, I mean, maybe we even have to start looking for some to do more complementary work inside the health department. So I think there's a lot of opportunity to look at that as we move forward. But again, timing is going to be really, really important on those other 2 grants that we know we can start the process on. We know we can start moving with the approval of the board today. We can start working with CDPHE, and through that process can talk about that 3rd grant as well. Keep working with CDC. So like I said, I do want to verify that staff, including our administrative staff who are going to be working on this, have the capacity, have the bandwidth to do it. But I know all the program staff have said, yep, we're right on board. Let's make this happen. We're ready to work on this any way we can. So I think we're prepared to really start moving on the 2 grants that we know are a possibility.
Jody.
Thank you.
And one last comment for now,
Go ahead.
Jerry.
Go ahead, Hilda.
I hear you, Sam, making another request from us, from the health board, is to give the CTC board autonomy. And this might be a legal question that we can post in a different setting, but I don't know if we have the authority to give that autonomy.
And maybe if I could expand on that, in case it was a poor choice of words, but what I'm really looking for is the Board of Health to, when I say grant autonomy, it's more of respect and move forward with the decisions that the board has voted on. So for the Board of Health, if with CTC wanting to move to CNDC, CTC has always been really a community-driven and a community-led coalition. And so for the Board of Health to support the decisions of CTC and the requests of CTC to make that move, if that is a decision that we're moving forward with the timing, to really to respect and elevate that decision-making in the community partners' hands is really what I meant. And so maybe autonomy being totally separate was a poor choice of words on my part. So thanks for allowing me to elaborate there.
Okay, thank you, Sam. And yeah, thank you for clarifying that. Appreciate it.
Are there any further questions or comments on this specific issue at this time? Otherwise, we will go to the very next agenda item that we have that will need to go into executive session. But I want to make sure all the questions are answered.
Maybe just one last comment, if
Sure.
that's all right. I guess I would just want to frame, even as we, position that we are wanting to make this move for fiscal sponsorship, I don't think anybody on our coalition feels like this work shouldn't happen in concert and collaboration with the health department. One, our work is so braided and blended already. And when you think about the outcomes in each of the different grants that we're talking about with the work that the health department does, know that we don't see this as sort of separating from the ability to work together. We see this as being more flexible in the community space, but certainly see that that's one of the most important partners that we have as we would move forward. So I just want to make sure that we're saying that really clearly as well.
Thank you, Dave. Okay. Any other questions or comments? All right, with that, I'm going to turn this over to Carrie. I believe you're still on, and Carrie, will you take us into executive session, please?
May I have a motion to go into executive session to obtain legal advice with respect to the CTC transition, as well as regarding the executive director hiring process pursuant to CRS 24.6.4024B.
I would move that we go into executive session pursuant to the specifics that Carrie has just outlined for us.
May I have a second?
Second.
Okay, all those in favor, please say aye.
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 Any opposed? Motion passes. We will go into executive session. And I really believe that we can probably wrap executive session up in probably, Carrie, would you say 45 minutes? So that we can give everyone kind of an idea when to come back in?
Yes, I think so, Sherry. Maybe less than that, but certainly I think 45 minutes is fair.
Yeah, I thought that was sufficient. Okay, we will go into executive session at, well, it's going to be 5 o'clock, and we will be back probably within 45 minutes. Thank you. And everyone, Hilda and Harriet, everyone has the link to get into executive session?
Yes.
Okay, thank you. Lindsay, can you see if?
Looks like we're just waiting on Harriet.
Yeah, okay.
Okay, and Harriet's joining now, so you're good to go.
Okay, let's call this back to order. It is 5:52, back into the regular board meeting. The executive session has been adjourned. So we want to have a discussion around what direction do we go now? I know that I can't speak for the entire board, but from what I hear from comments that they've made in this public meeting, that everybody is very supportive of CTC. It's been an invaluable program in the community, and everybody wants to see it do very, very well and to succeed. So we all need to come together as a partnership and as a team to make sure that we can get that going. Are there thoughts and ideas and discussion from my board members, from our board members, excuse me, that we want to think about as we move forward? Lane, I see your hand is up.
Yeah, thank you, Sherry. Yeah, I feel like there's still quite a bit to still discover, but I think the direction that I'm leaning, and I'll work this into a motion, is I would move that we direct staff to work with the CTC board, with their new fiscal agent, with our county attorneys to explore the transition of these grants. So again, making sure all the timing is going to work out. They do have the approvals from the various funding sources, and the timing from when we would, mutually agree to release grants with our funders, that does work so that the CTC can pick them up. So that would include all 3 grants. And again, if the funders are not willing to give it to CTC or their new fiscal agent, that JCPH stay in possession of those if it's not going to work out that way. But again, working on all the details that are going to be needed. So there's a lot of moving parts on both sides that, right now CTC hasn't finished any contracts with the new fiscal agent. So that all needs to be worked out, and JCPH staff and county attorney's office can help navigate that space and make sure nobody's left behind. That we don't want to see JCPH staff just left out to dry if the new funders and the folks are not planning to use staff. But again, try to make this as seamless as possible. And again, it feels like there's still a lot of moving parts. So once all the parties are on board and CTC board has signed and has a new fiscal agent, then it makes sense to make those transitions. But it just for us to unilaterally give up all the grants until all those other pieces are done doesn't make sense. So again, I would put this into that process of work through all the details that need to be done so that transition can happen.
Further discussion?
So Lane, was that a motion, or are you saying
Yes.
basically?
It was a motion.
Okay, I'll second it.
Okay, further discussion?
Yes, I want to discuss it before the voting. I also want to make my commitment to community-led organizations. I think it is important that we not only say that we support them, but we give them the resources to succeed. And I hope that this, it seems to me, painful process give us some lessons to learn so we can avoid this unnecessary difficulties for community-led processes. And I'm really concerned about the fact that we as JCPH, we don't have a way of supporting youth and giving community members who are working a way to be compensated. So that is one of my concerns. But in regards of this point, I also want to make sure that CTC has all the resources, funding that are needed, and the support with JCPH. It looks like Len mentioned, it's a long process, but we need to make sure that we don't let CTC kind of fight for resources, but we are there to support them all the way.
further comments? And I have to agree, there is a lot of moving parts to this, and we have to make sure every one of them is lined up so that we can all be really proud of the direction that it goes and make sure that there's a success at the end. And I would just encourage, as Lane put in the motion, to have staff, working with the other entities to get the exact details. And it's just very, very important. So we do have a motion before us. If there's no further discussion, we also have a second. Harriet has a comment before we vote.
So my picture just went away. I just want to comment that the motion may sound very complicated and convoluted to people, and that there's a good reason for that, because as Sherry said, there are tons of moving parts. But I think that the bottom line for at least me, and I'll just say it for me, and I think probably other people agree though, is that we do want to keep the resources from the 3 grants in our community, if at all possible. We want them to be coordinated and working together, but it may not be possible for them all to move with CTC. And so those are some of the complications that need to get worked out. But the collaboration and keeping that collaboration on the same kind of positive note that it's been on for years of CTC is very, very important. So that needs to underline as well the planning that we do and the moving forward that the staff does.
Thank you, Harriet. Okay, seeing no further comments or questions, all those in favor, please say aye.
Aye.
Aye. Any opposed? No. Okay, motion passes. So we can keep moving forward on this important discussion and getting things done. Thank you. The other thing that we really want to kind of have a discussion about is the hiring process for the executive director that we're in the middle of. And of course, we have the firm now that's going to do the search for us, EFL Associates, to take us through that. And I believe that one of the very first things they're going to do is start reaching out to people, to the board. Then of course they want to talk to some of the, the staff and all of that. And I think that that's just now starting. We've just signed the contract. And so they will be moving, very quickly. We would love to say that, oh yeah, and we're going to just make sure this is all wrapped up by such and such a date. But, this is also a very hard time in hiring, and it's going to take time, and we don't want this rushed. We have to make sure that we get, the right person in there. So we can't give you a date, but we want you to know that we are moving in that direction and want it done as quickly as possible, but again, making sure that it's done right. So I can tell you it won't be in a month. It does take time. Other comments from the board members? Lane?
Yeah, thanks, Sherry. I just wanted to, I guess, make a motion that we ask staff to work now with our new contractor, kind of prepare the contents we need to bring to a public meeting so we can outline, at least the rough timelines and approve, any of the necessary pieces we need to of postings and things like that. So they can work to set that meeting, and that will be the purpose of that special meeting, is to kind of try to ratify that. So once all those things are ready to come before us, that meeting can get set.
We would accept that as a motion. Thank you, Lane. Do we have a second?
A second.
Thank you. Any further discussion, questions, comments? Okay, all those in favor, please say aye.
Aye.
Aye. Any opposed, please say nay. Seeing none, motion passes.
I have another comment, Sherry, if I may.
Yes.
And I'm gonna make that comment in Spanish, so I hope everybody has their interpretation working. También otra de las cosas que a mí me gustaría que tomáramos en consideración en este proceso de contratar al nuevo director ejecutivo es el buscar la manera de escuchar no únicamente la opinión de los ejecutivos del departamento, sino también del personal y de los miembros de la comunidad. No sé cómo se verá esto, pero sí me gustaría también el que haya la oportunidad de recibir comentarios de parte de las personas que están trabajando actualmente en el departamento y la comunidad.
Okay, thank you.
Sorry.
Any further discussion on that? We will move right into our updates from the senior leadership team. And Dr. Rowan, I believe that I'm hoping you're still on. I'm not seeing your name, Dr. Rowan.
Yes. Hi.
Oh, there you are.
Hi there. Sorry, I am on my way home. So I'm in the car, but I'm hands-free. So it's safe. And I will just not have my camera on because I'm driving home. But I don't have a long update except to say that my year with JCPH is coming to a close. The contract ends September 30th. And Denver Health will be extending the contract 6 weeks, I believe. I'll be working with Dr. Belknap to provide coverage so that clinical services don't have to experience a gap. And we'll leave the other details about the transition to the others on the team to fill you in on in terms of who their next CMO will be. But I'm available for the next 10 days for questions or comments or concerns. And as I said, I'll be working with Dr. Belknap to provide.
I think we lost you. I think we lost Dr. Rowan. She may sign back in. And then we will put her right back in. Let's move on and hopefully she can get signed back in. Jody.
Yep, good evening.
Whoop, there she is.
Okay, sorry.
There you are.
Would figure, I was at work and decided, I'm gonna head home. So I must have hit a dead zone, but I'm not sure what point you lost me. But hopefully you got the main point. And please let me know if you will have any questions or concerns as we wrap things up. Thanks.
Well, I would just like to say how much we have appreciated you jumping in and working as the medical director. That has been through a very, very tough time that you took all of us on and did just a great job. So we're very sorry to see that you leave, but your schedule has to be just packed. And we're very, very grateful for the time that you gave us.
Thank you very much.
I'd like to echo that too, Sherry. Really appreciate the support.
Yep. Yep. And the other board members are nodding their head. So thank you, Dr. Rowan, for all the time that you gave.
That's true. She can't see me nod my head when she's driving.
No, she can't. That's why I said she's, the head is nodding.
Thank you for pointing that out.
Absolutely.
Thanks so much.
Yep. Thank you. All right, Jody.
Yeah, I was trying to debate before my update if the contract extension with Denver Public Health would get us Dr. Rowan on one more board meeting, but I'm going to go ahead and thank her this evening too, just in case she's not able to be here for the next month. Thank you for your commitment, your passion, the hard work. It has been a crazy year and you jumped into this during a very difficult time and just really, really appreciate it. Value your opinions and your approach and your thoughtfulness. So thank you very much. And thank you for considering the 6 more weeks. That gives us just a perfect timing, I think, to align at least another interim contract, which is where we're going to go for 6 months We're in negotiation with a couple folks, working on some contracting opportunities to kind of see what we can do next. We want to make sure, give the board the opportunity to get through the executive director recruitment, and then also kind of give our clinic an opportunity to really figure out what model works best, what we need as a clinic, as a health department, as we go through just a multitude of changes, budget conversations, staffing changes, and things like that. So we will have a contract signed by the time the extension expires with Denver Health, and that'll carry us for the next 6 months. And I think that's the only update I have tonight, unless anybody has any questions. Otherwise, I think I've had plenty of time to talk tonight. So thank you.
I have one, Jody. What is the plan after that interim for, I guess, thinking that we're still going to need some extension until an executive director is selected? Yeah,
so by November 15th, as we'll have Dr. and Dr. Rowe until November 15th as resources. And then by then we'll have somebody else on board. It's probably going to be, 8 to 10 hours a week to help serve the clinic, provide those resources to the clinic. And that's for up to 6 months. The person will be on call. It'll be a very similar setup and contract, I think, with just potentially more hours for the next 6 months. And then that, again, hopefully the clinic will, there's been so much change. We just haven't had an opportunity to really sit down and kind of map out exactly what we need in regards to that support beyond that 6 months. So hopefully by then we'll have a director selected, and they can also be a part of that process. But yeah, we'll have somebody in place for 6 months and go from there.
Okay, and Sherry, we lost Sherry. So Lynn, could you take over for right now? And
Sure.
Joe is next.
All right.
Director comment.
Joe, can you please share any comments you have?
Of course. Thank you, Lane. I had a few quick updates, but I wanted to start by thanking everybody who was part of the 2023 budget development process. Primarily, the heavy lifting that Salma has done, and of course the presentation. Thank you, Jody, for the presentation provided to the BCC. At which point we discussed some of the other factors I'm not sure that have been discussed here at the Board of Health or with the Board of Health. One in particular is that the county commissioners are considering using some ARPA dollars to fill some of the gap or some of the budget shortfall that we've discussed during that budget presentation with the Board of Health. So that figure, that amount still has not been formalized, but it is part of the discussion for the 2023 budget. I feel comfortable sharing that at this point because it is far enough along in that conversation that it does seem like it is going to be highly likely that the budget shortfall that was discussed during the Board of Health meeting will hopefully be replaced by ARPA funds that were issued to the county a few years back, or I think it was last year. So that is definitely some good news to share. I wanted to make sure that everyone is involved in that communication as it is being discussed with the BCC. In addition to that, there is some very good news in regards to some salary adjustments that has been decided by the Personnel Board, and that is to utilize some of the ARPA funds for staff adjustments to the tune of 5% that is being issued to all permanent staff members in Jefferson County. That extends beyond the Public Health Department into the various other departments in Jefferson County. So there will be a 5% salary adjustment for all staff members as of this next pay period, so here very shortly. That is a tremendous lift for this department as well as many of the other departments in Jefferson County, as we have been through the years lagging behind where the market has been placing some of those highly desirable positions. So hopefully that will be that will allow public health to be a little bit more enticing with our positions, with our recruitment process. And I think that really was the effort. That was the initial concern, and that was the reason why there was a big push for that to be initiated for salaries. I also want to thank Jody because he was probably more involved in that conversation as he sits on that personnel board. So a huge accomplishment for Jefferson County for salaries and for all of our tremendously wonderful staff members. However, as I do on occasion, I try to find the other side of the conversation, I suppose. And that is, as we all are aware, once we see additional costs, that then puts some strain on those revenue opportunities. As we see those costs for salaries go up, there's going to be a need to cover those costs. The ARPA dollars will be utilized for the fiscal years of 2023 as well as 2024. However, come fiscal year 2025, we will have to account for we will have to account for those costs. So the reason why I bring that up, and I hate to bring down kind of that conversation around the wonderful salary adjustments for staff members, much needed salary adjustments, is hopefully that's a call to action, that we should be considering how we make up those costs further down the road, primarily looking at strategically what we will be doing in 2025. So I just wanted to add that to the conversation, that although this is a great this is a great conversation to have about salaries and about our staff members and recruitment of new staff members that will be coming to this department, we should be looking further down the road as to how we will cover those costs and strategically what we will be doing in 2025. I did have one other quick item, and that is just another thank you to all staff members. Cybersecurity training has been a tedious task that we've all had to endure over the last several months. It is a training that is required for all Jeffco, I want to say staff members, but it is essentially anyone who has a Jeffco email address, anyone who has access to our network is obligated to complete all the cybersecurity trainings. And that includes those trainings that were released during the January and February timeframe. So it's anyone who is hired or anyone who is issued a Jeffco email address has to make up all of those trainings. So a tremendous thank you to everyone who's accomplished those trainings. This department is now past the threshold in which we need to be to avoid any additional costs for our insurance that is tied to those liabilities for cybersecurity awareness and cybersecurity, sorry. So although this is a training that is enforced by the county, it is needed in order to, like I said, avoid additional costs for insurance. So thank you to all the board members. I can only imagine how hard it is to find some additional time for that training with all of the other pieces that you're dealing with for Jefferson County Public Health. So tremendous amount of appreciation for all those who've completed that training. So thank you. That's all I have for today, unless there's any questions. Thank you, everyone.
Thanks, Joe.
Joe, I just want to make one quick comment. This is Sherry. It wasn't that it takes the time. It's literally almost impossible to get into sometimes. It has been very difficult. It's not user-friendly at all. Just saying, just saying.
I appreciate that feedback and I will absolutely pass it along. However, I don't believe you're the first person to make those comments.
No,
so
I'm pretty sure I'm not.
thank you for dealing
Thank you,
with the
Joe.
hassle. Thank you.
Thank you. Lane, did you want to continue?
Yeah, I do want to thank you, Joe. It's wonderful to be able to give raises if we have the money to actually pay for it. So that is just the reality. And we know the fiscal constraints that the county is facing, and that's not going to likely change unless there's significant efforts to look at how we deal with funding as a county. So I appreciate you being fiscally responsible, as this board needs to be as well.
Thank you, Lane.
Okay, Jim Rada, it looks like you're up.
Good evening, everyone. Just a couple of quick announcements. I just entered into the chat 3 links as a reminder that the community meeting associated with the Tarumo BCT ethylene oxide emission issue is this Thursday evening from 6 to 8:30 online. if you click on either the CDPHE or EPA links, there is there's a connection there for registering for the community meeting. I'd encourage the board, if you have the opportunity to attend, to learn about this issue. All of this is, as I've shared with you before, kind of the run up to a rulemaking effort that's going to begin here in the next couple of months from EPA to further regulate and reduce emissions of ethylene oxide from medical sterilization facilities across the country. The large facilities that are out there. So that I just wanted to let you all know again that this meeting is coming up. There's information there on those links. There's a lot of information on those links about ethylene oxide, the health effects, and other issues associated with it, as well as how to become involved or get involved in the rulemaking process. The only other thing I wanted to share was that the Sustainability Commission's work on the Climate Action Plan for Jefferson County has continued. The planned community engagement work has been completed, although the Sustainability Commission has recognized that with a little input from us, that they really didn't get true community engagement from the types of communities that in the way that we would want to see them reach into those communities to really address the impacts of climate change in disproportionately impacted communities. Thank you, Harriet, for being part of the steering committee. I think that the Sustainability Commission has heard loud and clear and has expressed their desire to try to do a few more outreach events to various communities, especially those disproportionately impacted communities in Jefferson County. The consultants that we are working with are in the process of developing the initial draft of the county's climate action plan. They will be hopefully have that available for public review by November. The intent is to have the Board of County Commissioners review and approve the final product by the end of the year. So we'll see if that all happens or comes together, but the work is continuing. My sense is, and Harriet, you might have a different opinion, but what we're going to see are a lot of potential solutions and action steps. But the next step will really be about how do we implement this climate action plan as a county organization. So certainly it's not completely a public health effort. I think it's going to be a community-wide effort. Many of the municipal governments are also engaged in the process of developing this plan. So my hope is that it'll be well coordinated when it comes to working on the implementation phase of this plan. And that's all I have for you this evening.
Well said.
Thank you.
Well said. Thank you. At some point, it might be great if you were on the beginning agenda of the working group, maybe you and Harriet, since she was on the committee as well, to kind of give us an update and give us a little more information on what they're looking at with the climate stuff. That would be interesting.
It would be interesting. I'm not sure I'm capable or thoroughly capable of explaining it all, but I also would be willing to approach the consultants if the board is interested to have, or some of the Sustainability Commission members to come and discuss the plan, in particular, the aspects dealing with health equity and environmental justice, and how we've approached incorporating equity into this plan.
Thank you. I think that, I mean, it is something that the community is very, very interested in. And so we'll connect offline. We'll talk about what maybe that would look like. Thank you.
Very good. Thank you.
Is that it, Mr. Rada?
That is it. Thank you.
Okay, Carrie, you're up.
Good evening. Nice to be here with all of you tonight. I'm going to start my updates with a congratulations to our Employee of the Month for September, who is Samantha Gibbs, one of our public health nurses and family services. This was based on her nomination by her current supervisor, Kate Follett. And I'm just going to read part of her nomination letter to you all. Sam has demonstrated admirable resiliency in the face of lots of change, uncertainty, and staff turnover on our team and programs. To specifically note, Sam has supported our team's admin assistant duties since that individual retired and has began formalizing a Medicaid and NPI process for all department staff. Sam has also worked tirelessly on our agency's partnership with WeCycle, including a newly developed car seat program that provides significant benefits to the families served by JCPH. Sam has continued to perform her job duties, support her team's program, and support the team supervisor, despite what feels like never-ending change and uncertainty for the future. She clearly communicates her desire for her career while maintaining flexibility and resiliency. Sam also expresses desire for her own professional growth for the sole purpose of being better able to serve the families on her caseload. Sam continues to show up for her clients, team, and supervisor, even when things feel hard and unpredictable at work. Despite the uncertainty of a program on our team, Sam has demonstrated dedication and enthusiasm in regular meetings with her supervisor aimed at building up this program. She's also expressed her own independent desire to continue her education and professional growth to best serve the families she is so passionate about working with. Sam works well with others through effective communication, having an open and flexible outlook, and being willing to participate in projects to effectively further the goals of JCPH. So congratulations to Sam Gibbs.
Thank you to Sam.
Yeah, I don't know if she's still on here, but I wanted to make.
You know what, I looked and I didn't see her, but it'll be fun because, you know, she'll be able to, hopefully we'll be able to meet her at the next luncheon that we have for the employees of the month.
Absolutely.
Yep.
So another update I want to give, and I think you might be aware, but if you are not, I wanted to make sure you knew that after 15 years, I am leaving JCPH. This will be my last Board of Health meeting as a division director and as a staff member of JCPH. So I want to just say publicly how much I've appreciated the opportunities I've had at JCPH, and I hope that the service I provided has been of a benefit to our county. And I appreciate the senior leadership team who has supported me over the last 9 months in this current role. So due to family circumstances and eventually going into a new direction for my career, I'll be leaving JCPH, but very appreciative to all of you for the work you do. So thank you for giving me a chance to say that. I do have a few other updates. I don't know if Jody has a question. His hand is up.
Don't have a question. I do have a comment. I just wanted to say, as soon as there was a vacancy in this position, I thought of you immediately because of just the way you've approached your work and your time here, the leadership that you bring to this organization, just everything, your attitude, your style, the support you have from staff. Immediately, I wanted to approach you about this role. So just wanted to say thank you for taking on, again, very challenging time in this organization. I really appreciate the way that you picked it up and ran with it, and just the support you've given your team. And I've received nothing but just amazing and positive comments about you, your work and your approach. So thank you so much for the time that you have given us. It was well worth it for us.
Thanks so much, Jody. And I made my apologies to Jody and our leadership team earlier because I said I would stay in this role for at least a year. And unfortunately, I'm not able to do that at this time, but I've very much appreciated everything I've learned and the time I have had to serve in this role. And I also, as part of that update, I want to say that the leadership team is working really closely. The senior leadership team is working closely with me and with the leadership team of family services to ensure a smooth transition. And the position has actually just been posted as of yesterday. So we are moving quickly so there won't be a gap in not having a director of family services for very long at all. And the senior leadership team has been very supportive and have individual point people taking on responsibilities and ways to support this division during that hopefully short gap of not having a director. So very much appreciate that. And also all of the supervisors and leaders in that division who are very self-sufficient and autonomous and able to carry forward the work. I wanted to let you know that on September 8th, our entire division met in person for a half-day it was a workshop facilitated by the Ottawa group with an emphasis on team building. Our division has changed in recent months with WIC coming over from the former HPLM division into family services. So it was a wonderful opportunity for us all to come together. And we focused on some fun team building activities, but also discussing, what is our vision? What is the culture of our division? And why do we work at JCPH? And I just wanted to share a few of the highlights that came out of that question of why do we work at JCPH? Some of the things that were noted and highlighted were, we want to make a difference in the community. The work at JCPH is rewarding and it is gratifying to collaborate with our coworkers. JCPH provides opportunities for both professional and personal growth. JCPH allows us to do meaningful work based on our lived experience. JCPH is in alignment with our personal values. We want to uphold the positive reputation of JCPH in the community. So I just wanted to highlight those very noble motivations that bring people to work at the health department. I also want to mention that WIC is receiving new state grants. I might have mentioned this last month, but the state is asking Jefferson County WIC to expand their services to surrounding smaller counties. And so they're currently in the process of hiring 3 new staff to support that work. And the last thing I wanted to highlight was Kate Follett, who is currently working as the supervisor for Samantha Gibbs, who was our employee of the month. Kate has been our public health nurse who's worked with the Family Integrated Treatment Court with Human Services and the courts. And she is currently working in collaboration with one of the Human Services Division directors, Barb Weinstein, to rewrite a contract and update a program that provides short-term care collaboration between families who are involved with human services and child protection and Jefferson County Public Health. So we had that program for a long time, and it really needed to be reevaluated and updated. And I just want to applaud Kate Follett for the work she's doing to rebuild that and make that a more effective program, and just the high level of the high regard she has seen at the Department of Human Services has allowed her to really work in collaboration for looking at some things that maybe needed support or correction in that program, and that she's really built a really fine partnership with Human Services to improve that program and move it forward. So we look forward to that contract coming back to the health department in the coming months and rehiring nurses to basically have a renewed program and a renewed partnership with those families. So that is all I have to share tonight.
Thank you, Carrie. And you are going to be sorely missed. We have appreciated you very, very, very much. And thank you for stepping in when you did. You've done a magnificent job. So thank you. We now have Gwen. You're up from Clinic Services. Whoop, you're muted.
You're muted, Gwen.
There you go.
Oh, thank you. Sorry, I was trying to unmute there and it wasn't working. I apologize. I don't have any major updates, but I just also wanted to extend my thank you to Dr. Rowan for all her support and all her guidance over this past year. It's just been amazing. And I just want to wish her best on everything that comes next. And then also, Carrie, you are going to be greatly missed. Thank you for everything that you've done at JCPH, and good luck on your new adventure. So thank you very much.
Thank you, Gwen. And then Christine Billings, are you up? There you are, you're on.
Good evening, everyone. I also just have a couple of updates along with my added thanks to Dr. Rowan, as well as just a huge virtual air hug. I'm going to do that to Carrie for all of her work, and she has been here just a hair longer than I have, and so all of my time at JCPH has had a Carrie in it. So you will be greatly missed as I've seen you grow and flourish in your roles at JCPH. So thank you for that. On my team, our health communications group is extremely busy sharing all of the news of JCPH across all of our programs, which is a nice shift to really promoting the whole of the work that our health department does. They have worked hard on a health communications plan, which will be presented to the senior leadership team tomorrow, hopefully to be approved and then subsequently implemented starting in January of 2023. Our disease investigation team and our infectious disease epi team, their big news is we have both received an additional funding bump from the state of Colorado for work on our MPX investigations. And so we have taken over all of the Jefferson County case investigations for MPX. And as well with this funding stream, we are able to support the very hard work that is going on in our clinic with both vaccinations and testing for MPX cases. So that work can go on, and we are very thankful to the state for that additional push of funding. We, of course, are busy with COVID still. We are in a lull, and we have an updated bivalent booster, which I had mentioned in a previous setting, but that booster is available within our clinic. So Gwen, I'll give your team a shout out for that effort as well. They were so busy last week that we had to close clinic a little early because we ran out, which is really great news for the work of the Jeffco team. So thank you to all of them. And then our preparedness team, you heard from Anjanette, it's National Preparedness Month. So we are supporting both internal staff planning as well as external planning with our health and medical partners and our emergency management partners. So that's all the updates I have from our team.
Well, thank you, Christine. It's not like you haven't been busy enough. Okay, do we have any staff comments? Not seeing any hands go up. Okay. Board of Health comments. Do we have comments from our board members?
I do, Sherry. I just really also want to thank Carrie for her service to the community. You're definitely going to be missed.
Yeah. Harriet?
So yes, thank you, Carrie. I think you've done an excellent job from everything I can see from my vantage point on the board. And thanks to Dr. Rowan. And thanks to Jim Rada who, because of his great report on the sustainability stuff, means that I don't have to say anything more. So.
Thank you, Harriet. And I just have a brief comment. We are losing another board member. And so of course, we're going to be very sad about that. Kimberly Kropik has things that have come up now that she will not be able to fulfill the rest of her term. She is going to stay until the end of October, but we are going to miss her. She did put the notice in with the Board of County Commissioners. And so they have immediately turned around to post, that they're going to be bringing on another board member. So that should be by, I'm going to say, I think they said they were shooting for October 25th, towards the end of that month, next month. And so we will not be without an actual board member, but we will miss Kimberly. She has done a great job, and I'm hoping she'll be able to get to the October meeting so we can all say our proper goodbyes. And we have our Employee of the Month luncheon coming up. I'm not sure what the date is, usually the last Tuesday of the month, but your directors will all let you know when that is. And we enjoy those. So we love to have the Employees of the Month. And with that, I do believe that's all we've got. Is there anything else from the board members, from Lane or Harriet? Hilda had to sign off. She had another commitment she had to get to. And I really want to thank everybody for putting in this time today. I know it was a long meeting. We just had a lot that we had to discuss. And so appreciate you letting us have an executive session that took longer than we thought it would, and getting all of this stuff worked out. I don't see any other hands going up. So with that, we will adjourn. Thank you all very, very much for your time.
Thank you. Have a good evening.
Thank you.